Hey, this is Mike Casu, and you're listening to the Brute Strength Podcast. This week's guest is Dr. Aaron Horschig. This is one of my favorite episodes in quite a while. Aaron's one of those guys that you just know that he's doing what he's doing for the right reasons. He's not trying to sell any gimmicks, any bullshit. He gives a ton, just an enormous amount of highly valuable information on his website, squatuniversity.com. And he looks at the body as a whole rather than just as individual body parts. And that goes a really long way when it comes to injury prevention, rehab, and performance. We dive into a lot of the different principles and concepts of his book, The Squat Bible. And the thesis of that book is that in our society today, we are overly performance driven, where we forego quality for added numbers. And he talks about why that is, why that's detrimental from a longevity standpoint, but also from a performance standpoint. And he strongly believes that if we focus on quality first, we're going to be able to move more weight, run faster, jump higher. And we're going to do that. We're going to be able to do that with less pain, and we're going to be able to do that for much longer in our lives. This one was a pleasure for me, and I hope you enjoy the show. Aaron, thank you so much for making some time for me, bro. We've been trying to get together for quite some time. I've been following you for a really long time and admiring you from afar, and I feel privileged to get to have this conversation with you. So thank you.
Hey, thank you so much for having me on the show. It's a huge honor.
So I want to start out by saying I absolutely love your website, man. It's an incredible
I appreciate
resource.
it. Thank you.
I forget what the tab is, but you have a list of like a huge list of really common questions people have about movement, pain, rehab, and you go into like the perfect amount of depth, right? So that athletes that aren't very technically savvy can understand it and apply things for their own movement, and coaches that kind of do understand a little bit more can understand a little deeper and apply it to their clients. So anybody listening, go check this website out. It's incredible. Here's where I want to start for the interview.
Okay.
In your book, you start out with this concept of the looking glass of movement. That's kind of the, like, if there's a thesis to your book, it's that. And the basic tenet is, in our society, we've become so performance driven, right? We have more PRs than ever. We've got tons of Olympic records being set every quad at the Olympics, but we are more injured than ever. And I think it's interesting that you're a competitor yourself, right? You've been in weightlifting for a number of years, maybe about 10 years, but you've been able to take a step back and look at it quite differently than most people. What do you attribute being able to look at it in terms of quality first rather than weight on the bar?
Yeah, so I mean, I think it comes and just sort of stems from both my participation in weightlifting for so long, but then also brings into it my background in strength conditioning and physical therapy world. You know, being a competitor in Olympic weightlifting for so long, you obviously have that drive to continuously try to lift more weight and set new PRs. But coming from see the injuries, you know, I see people walk in that have developed injuries, yet for some reason, you know, we would classify them as elite athletes. You know, they're bigger, they're faster, they're stronger than many out there, yet for some reason they're still sustaining injuries. And I've sort of come to the point where I've decided it all boils down to the quality of our movement. You know, we get so many athletes nowadays who have basically rearranged conceptually their athletic priorities to such an extent that all they care about is that next PR, how much weight's on the bar. I mean, if you think about it, if you scroll through someone's Instagram feed, what are you seeing? You're seeing their PRs, you're seeing their biggest lifts. You're not seeing their warm-up sets most of the time. And in doing so, we've sort of created this facade that athletes need to lift big all the time, and we need to constantly set PRs. I remember seeing an athlete, he's fairly good weightlifter, and I think the tagline to their video was it's rest week, so we decided to max out in like hang clean doubles or something like that, something that was out of the ordinary for their normal training. And I'm like, that totally misses the point. You know, our goal is to be able to move well first, and then make sure that we're using our training to sort of set up our body to perform well, but to do so for a long time. You know, the looking glass of movement is a way of saying, hey, let's take a step back and understand what the big picture is. If you look at it from two different standpoints, with weightlifting performance wise, we analyze the body so in depth that we want to know every single little marker as far as sports performance goes. We want to be able to run a faster 40. We want to be able to jump higher. We want to be able to lift more weight. And it all comes down to be able to, you know, sort of rack up those performance accolades. When you look on ESPN, you know, the top 10, what are you looking at? Performance markers. Like you said, every single year we're hitting more and more PRs. Every single meet, there's more and more PRs or world records set. When you look at it from the physical therapy standpoint, in just the medical world, we look at the body so much through a microscope. When I was going through physical therapy school, when you talk about elbow injuries or knee injuries, you first talk about the entire anatomy that's going on at the knee. You never really talk about, well, what happens if the ankle's blocked, or if your core stability is poor? How does that contribute to a knee injury? So my whole goal is to say, you know, let's take a step back and understand the body from a movement perspective, because as strength and conditioning professionals, as medical professionals in the physical therapy world, chiropractic world, athletic training world, we speak the common language, and this language is movement. Because if you can move well, you can do both things. First, it sets yourself up a better foundation to perform better. I don't think anyone's going to argue that someone who has better technique is more set up to be able to lift more weight.
Yep.
Well, in the same sense, if someone moves really well from a biomechanical standpoint, they're less prone to sustaining injury, because it's almost like, you know, if you've got a really, really fast car engine wise, and you put that engine in a piece of crap car, you can only drive it so hard before things are going to start breaking down. But if you put that same engine in a car that's finely tuned, it's going to be able to run really hard, but for a long time. And that's sort of the thing when we talk about movement, is we have to be able to understand the entire concept of the body, and not just sort of look at one part or just focus on just the output of the body performance wise.
I think it's really interesting. It's really easy to see in, say, ball sports, the importance of movement quality. It's a little harder in something like CrossFit or lifting, but you know, in my time at LSU, I got a real understanding that there's not a very high correlation between your weight room performance and on the field performance. What you do in the weight room should only support what you're doing on the field rather than taking away. And I think a lot of strength and conditioning professionals, coaches, they really just miss the mark. They think more weight on the bar equals a faster 40 time, and it really just doesn't, right? If they don't have proper mechanics, it really has a super low correlation, actually.
Yeah. That's funny you bring that up. I was actually just talking to a baseball player who's in college. He was coming through my clinic, Boost Physical Therapy, the other day. And he was talking about how, as a baseball team, they were doing hang cleans. And, you know, he's been trying to follow some of the stuff that I put out and really focus on his technique. And he is telling me about how, you know, a lot of his teammates are more worried about how much weight's on the bar. So they're trying to hang clean in their regular training, you know, 300, 340 pounds. And it looks like crap. They're throwing it up high. They're spreading their legs out 5 feet just to be able to catch the bar. You know, totally poor technique, but they're throwing up 340. So they think that they're, you know, doing something amazing. Yet, you know, that same person may be doing, you know, a 240 or 250 hang clean. But if it's done with that much better technique, control of their body, speed and power production, you're going to have that much better carryover to what's the ultimate goal for baseball players, to be able to perform on the field. So if you're not supporting yourself well in your training, you're not going to have that carryover.
Right. And the goal for a baseball player obviously isn't just to, like, there's no reason, no inherent reason they just need to have good, clean technique, but it's what it kind of what it's about, what it points to, right? If they have poor technique, it's what we can learn from that poor technique. And one thing I think is so interesting that I heard I think it was like a NFL scout say, like one of the first thing he looks for in linemen is their shin angle, right? If they can't achieve proper shin angle, like they don't have enough ankle flexibility, then they have they're at a huge detriment because they can't get in a proper start position. So if they have if we see that a lineman has an improper squat, then it allows us to look deeper at why do they have an improper squat, right? And allows us to work on that ankle flexibility, help them get in a better start position, makes them a better football player. Whereas we could let them have an improper squat and get them up to a 700-pound back squat, and that doesn't carry over at all, right? Because they can't fire off the line correctly.
Exactly. And that's why the squat is so much more than just an exercise. What I try to preach so much is the squat is a movement ever before it's an exercise. When you look at the squat, the first thing I do when I have someone come to me that I'm evaluating them, whether they're injured or not, maybe they just feel something's wrong in their body, they don't have a huge injury. The first thing I do is I say, take your shoes off and let me see a full depth squat. I want to see what you're capable of movement wise. Now, like you talked about, shin ankle mobility is the most limiting factor, I believe, in the depth of a squat. So if you have someone that has horrible ankle mobility, either from a ton of stiffness or maybe they just haven't used that body capability for so long and they've sort of developed compensations in the way their body moves and handles and coordinates itself, you're going to show a very, very poor movement wise squat. Now, talking about an NFL lineman, I remember I had a couple years back, it was one of the starting tackles for the Atlanta Falcons came through and I got to see him for a little bit. He was dealing with horrible hip pain and knee pain. And during our evaluation, one of the things I had him do was a squat. And I'll tell you, this guy could not squat even to parallel. Wow. Yet this guy's getting paid millions and millions of dollars to be able to, do his job on the front line. Yet because he doesn't have that movement capability, over time, all those repetitions and the force that he's putting on his body eventually leads to a breakdown in what his body's capable of doing. Right now, he's not even playing in the league because he was sustaining injuries for so long. So like I said, it all comes down to the movement capabilities and the quality of it, because if someone can perform better quality movement starting at first with body weight, and then we're talking about our technique, it sort of sets a better foundation for what that person can do and what their body can handle. So if we're talking about performance-wise and injury-wise, again, it all comes down to that technique. And the squat, and talking about shin angle and the ankle mobility, is one of the easiest screens that anyone can do to sort of point out those flaws and illuminate what that problem has going wrong with them.
Right. So at the end of the day, you're a movement expert, you're a physical therapist, but you're also a salesman, right? You're selling people on this really unpopular idea, which is a lot of times, hey, you need to take a step back before you can go forward, right? How do you sell this idea to someone that is not currently injured, but you can tell that their only future is to get injured? How do you sell that to them?
It's extremely tough. I mean, this is where you have to boil down to the psychology of an athlete. And as a physical therapist, I deal with this every single day, because when I'm working with an athlete during our initial evaluation, one of the most important parts that I really pride myself on what I do with the athlete is the education standpoint. So we'll go through, we'll do our evaluation where I'm finding, where their weak links are, where their strengths are and whatnot, and sort of what boiled down to why they're injured. But then we just sit and talk for 5 to 10 minutes, and it's all about educating and empowering the patient, because if they don't understand what's going wrong or where they're at, man, there's no way they're going to want to be consistent with coming to physical therapy and going through this long rehab process to either get out of an injury or get back to better quality movement. And the one thing I tell them is, what you're capable of doing right now is only half or a percentage wise of what is possible with better technique. I see athletes all the time. If you watch the Olympics and you watch the athletes, Olympic weightlifting, for example, the athletes that are making it to the Olympics, most of the time, they are the cream of the crop as far as technicians of how they perform the lifts. When they warm up, they're bar warm up all the way through their different sets, all the way up to the extra, the movement that they're doing on the platform looks exactly the same. It's crisp, it's powerful. They approach, 40 kilos the same way they would approach 200 kilos. Now, yes, there's some variation, and everyone will point out, well, what about this athlete?
Yep.
What about this person whose knee caves in? What about this person's whose back rounds? You know, the deadlifter who's an elite athlete who's pulling 900 pounds yet his back rounds. What about that guy? There will always be outliers. There are always going to be people whose bodies are able to subject themselves to more harmful forces and their bodies stay strong. But 99% of people cannot. So when I'm preaching to people or teaching them and, you know, putting out all this content.
I'm preaching to people.
And when I'm preaching to people, I'm not preaching to the 1% of elite athletes who can move poorly and still move big weight. I'm preaching to the 99% of people who, if you do not move as well as physically possible, you will eventually sustain an injury. Your body will not be able to do this for that long, moving poorly with big weight before it breaks down. And B, you are capsizing yourself for your end range potential. So I think when you're talking to an athlete who maybe doesn't have an injury right now, and I say, you know, you may have an injury one day. A lot of athletes are going to go, well, screw you. You know, you don't know that I'm going to have an injury. You know, I'm moving 500 pounds in the squat like nothing. You know, who are you to tell me that? So coming at it from an injury perspective point of view and trying to preach at that, I don't think that's the best way to teach an athlete, because I don't think an injured or a healthy athlete often will listen to someone else. It's almost like your mom telling you to go clean your room. You don't want to go clean your room, so you're not going to listen to your mom, even though she's right. Yep. Right. So I think the big way that you sort of approach it with the athlete is to understand where their mindset is. And it all boils back to what we started with at the start of this talk was our athletes' mindset right now, especially in today's society, is on what? It's on performance. It's on how well they can lift, what kind of PR they can set, how well they can, you know, make this video look so they can put it on Instagram and get 1,000 likes within an hour, you know? So I think if you come at it with the mindset of, hey, where you're at right now is good, but if you can take a step back and focus on the little things, if you can add these corrective exercises to improve your knee stability, man, maybe not right now, but a year from now, you're going to have 20 more kilos on your clean and jerk. You're going to be able to back squat 50 more kilos because you're going to be able to do so with better technique. And I think for some people, it resonates and they do it. And I think others, you know, it's harder to get through to them. And unfortunately, I think those are the people eventually that are going to have to learn the hard way. And they're going to eventually come find you whenever they have an injury. You know, there's no strength athlete that has ever, you know, gone through a year of training without sustaining some, you know, kind of injury, whether it's an ache and pain, you know, my hip's hurting today, my knee's sort of achy today. It doesn't need to be a big injury. You know, the weightlifting, powerlifting, CrossFit community, there's not a ton of huge injuries. They happen every once in a while, but most of the injuries we sustain only, you know, take us, you know, a couple days, maybe a week off of training max, and you're back at it because you're used to pushing through and grinding through aches and pains. But eventually they're going to, you know, accumulate. You know, Vasily Alexiev, or Alexei Vasily, you know, one of the most famous Russian weightlifters of all time. I mean, if anyone saw him before he died, I mean, the guy could barely walk. His back was so bad. You know, you see a lot of these athletes, even elite athletes, you know, they ignore and they push through pain over and over and over again. And, you know, eventually it's going to take its toll. And that's sort of where I come at it from and try to teach athletes is my goal is not only to have you move big weight, but I want you to do so for the rest of your life. You should be 70 years old and still being able to lift weight. You shouldn't be subjected to having to walk with a walker by the time you're 80. So it's sort of, you know, taking a long-term approach as well to a short-term performance approach.
Just to dive in even deeper into the mindset piece, my wife, Adi, told me last night about this awesome thing she heard on the Oprah podcast, the Soul Sessions or whatever. I think it was with Janine Roth. And she said something to the effect that our relationship with food, and the topic was like conscious eating. Our relationship with food is almost an exact reflection of our relationship with ourselves. If we shove shit in, are inconsistent and generally feeling like terrible, then it suggests that we have kind of a scattered, potentially negative internal space, right? Internal headspace. Do you think that that there's a correlation between the way that we move and the way that we train our bodies and the way that we feel about ourselves and kind of the way that we operate in life in general.
100%. I mean, I think the way, and that's the thing is a lot of people think that the way you move and the way you train is only something that you're accountable for when you're in the weight room. You know, athletes are only athletes or are not only athletes when they're in the weight room. They're an athlete 24/7. So the way that you're moving is something that you do for life. How are you going and bending over and picking up a bag of trash? How are you, grabbing groceries and walking with it outside of the grocery store? You know, the way you move echoes not only in your training, but I think in everything that you do in life, and all that accumulates and will either have positive outcomes or negative outcomes. You know, your body adapts. Your body is crazy strong in the way that it adapts to the stimulus that it's provided. So if you feed it, you know, just like the way bodily, food and fluids, if you feed it bad stuff coming in, you're going to get bad stuff on the way out. You know, if you move well, maybe only in the weight room or, you know, partially well, but then when you're outside of the weight room, you're slouching, you're sitting down all day, you're not moving well. When you go to pick up a bag of trash, you're bending over, your back's bending, even though it's a small load, it's still a load. You know, those things accumulate and you're going to have, you know, I think it's going to have a crazy outcome as far as how your body handles that stress longevity wise.
I think it's also a focus. Obviously, it's an over focus on the outcome, right? Which again is so big in our society. We always focus on the end result rather than how we get there. And we know through some of the best, like the highest performers in the world, that focusing on the process, focusing on how we do things is even more important than where we're even headed, right? Because we can focus on the process and get to where we want to go. But if we only focus on that outcome and don't have like a roadmap of how we're going to get there, then we're not really sure where we're going to go.
I think as an athlete in any sport, when you learn to fall in love with the process, that's when you really become elite. You know, if you look at every single athlete who makes it to the top, they fall in love with doing the small things. They're there before practice time starts. They're practicing hard. They're focusing on doing things perfectly. They're doing things correct outside of practice. You know, if we talk about strength athletes, they know that in order to make it to the next level, they need to do the small things. They need to focus on warming up well. They need to focus on the corrective exercises to improve their technique. They know that every single time they touch the barbell, it has to be perfect technique. Yeah. And it's because it doesn't matter if you're on day 1, day 280, or day 500 of a training program. It's all about the accumulation of every single one of those stresses and making sure that everything can come together to produce the end result. But too often today, we're so focused on that end result that we miss that it's the process that makes everything and makes that end result, you know, worthwhile. I mean, some people, you know, in my personal opinion or in my experience, you know, some people they live for that meet day. You know, they love getting out there and getting on the platform. And I love the platform too. But let me tell you, especially in the past couple of years, I've had so much more fun just going through the process of training and seeing the small changes and, you know, putting the pieces of the puzzle together to find what the end thing is, more so than the end product. And I think, and in my experience, that if you can focus on, you know, putting together the pieces of the puzzle and what fits here, what needs this, and maybe we need to fine tune this, and focus on falling in love with the process, you know, you're going to win in the end.
Yep. You have to be willing to take time out of the equation, though. You can't say, I have to be able to do this by the Open or within a year or by, you know, nationals, whatever that may be. You have to be willing to just commit to doing things correctly, and whenever the results come, they will come. But you know that by focusing on doing things correctly, that it will happen eventually. But you have to be able to take time out of that equation.
Exactly. I think patience is one of the most important virtues to any athlete, especially a strength athlete. We get too caught up, I think, in tracking sort of the qualifying numbers or the numbers of our competitors so much that we sort of become short-sighted in understanding the big picture. I found this in my own training as well. Dating back, I remember when I first started Olympic weightlifting back in 2005. I remember one of my coaches at the time, and I'm a very mediocre athlete. I've been able to qualify for a couple national meets. And my coach, I remember saying, he was like, if you don't make the American Open by, your fourth year of training, you're going to be a failure to me. Obviously, he was joking, but it was something that that's all I thought I needed to do. I constantly was thinking, what are my qualification totals? What do I need to do? And I think it became such a big thing in my own mind as an athlete that I didn't enjoy the process. I didn't do the small things. I was only focused, especially when I was at a meet. All right, what do I need to hit to qualify? What do I need to do this? And in training, it's what do I need to do to get this number? I wasn't focusing on the small things like the technique, the perfect technique on every single lift in the process of doing things. And it wasn't until I think, a year after that I graduated and I stopped thinking about that. I was able to qualify for my first senior nationals and place with that and, do so much better performance-wise because I wasn't, I think, having that hanging over my head that I needed to qualify for this specific meet and hit these specific numbers.
Yeah, it sounds like you were focused on things that you could control, like your own habits and practices, rather than how you compare to others. That's key. Mm-hmm. So I told you I wasn't going to talk about the squat, and just for all of you listening, the reason I said that is because Aaron's already been on some great podcasts and covered this topic ad nauseum on his website. So you can go to squatuniversity.com. You can go to Instagram and look it up. You can listen to Barbell Shrugged, Active Life RX, the Airborne Mind Show, and they go deep into the squat. So I don't want to recreate that, but I do have one question. Why is a proper squat so important to human beings in general? I know that babies squat that way. So do people in Africa. But most people in Western society have chairs and sofas and all of that kind of stuff, right? Why does it even matter?
Yeah, I think the reason it matters is because the squat is a fundamental human movement that I feel like many people have lost. Let's talk about, the different movements that we have capable to our bodies. We can walk. We step, we run, we can push up off the ground. We can almost basically like a deadlift, bend over to pick something up. And then you have the squat, lunge, different movement capabilities. I feel like of all the different movement capabilities that our body is capable of, the squat is one movement that over time our bodies have lost, especially those that live in our societies today that have so many chairs and different amenities to us that we forget how to move well. We think that we can make up for sitting 8 hours a day with a 45-minute workout and then go home and sit the rest of the day on our couch. We never fully express what our bodies are designed to do. And when that happens, we can take barbell training completely out of the picture. And when you just talk about how you're using your body correctly throughout the day, eventually over time, your body adapts to not using its full capabilities. And I think that's when eventually injury sets in because your body isn't being used as it was designed to. In our society, we have 80% of people at one time or another are going to have back pain at some time in their life. And we look at during the squat, what's one of the most, common things that we see is you have very mobile hips. Your hips have to be able to descend pretty far to be able to get into a full bodyweight squat. Ideally, I want to see a flat back, a nice stable core during a bodyweight squat. Two of those things combined, that's where a number of people have back pain. You have back pain because either you're limited in your hip flexibility or you're limited in your core stability. And then over time, those forces on your back sort of come together and you develop pain. Either you have a muscular strain, you have a bulging disc, you have, stenosis, different things. All of it can be related, in my experience, to the way that someone is moving, carrying, and handling their body. So what I found is that you can take any single person out there that has some type of pain from their back all the way down. And if you can restore their movement capabilities to perform just a basic bodyweight squat and then do so throughout the day, you're going to see drastic changes in how your body feels. We went back to, are you giving it the right type of food? Well, I think, proper movement is an essential vitamin for life, just as, eating, your carbs, protein, fats. You need proper movement for your body to feel well also. And I think if you can nail down the ability to perform a basic bodyweight squat, regardless of if you have aspirations to perform strength-wise in the barbell movements, I think you're going to see drastic changes in the way that your body feels and your ability to live the life that you want. We talk about, correct aging, and I know a lot of athletes are very short-sighted and they're only thinking performance. Well, obviously, like I said, I'm talking performance, but I also want to see longevity. Man, right now, I'm 31 years old right now. When I was 19 years old, do you know how old I thought I would feel at 31? I don't feel old at all. How do you think I'm going to feel when I'm 50? How many 50-year-olds, though, do you think can sit in the bottom of a deep squat with ease? Not many.
Right.
How many people who are 50 or older, how many people listen to this podcast who have parents that are older? How many of your parents have had back pain or have had knee pain or have had achy hips or can't move the way they used to? Well, if you can restore that one simple movement, I think it opens the door for what's capable for the rest of your life.
I'm just throwing this out there. You should consider rebranding as Benjamin Button therapy.
I love it.
I want to throw out a few, and they're going to probably seem a little bit random because they're at like very different parts of your book, but I want to talk about a few principles that you talk about in there, because I think if people understand these principles, it can help them access become aware of some really huge new things for themselves. And the first one is the joint by joint approach. When I read Mike Boyle's book 5 or 6 years, this thing was just mind blowing. And I just remember it shifting the way that I thought about the body in general. Can you explain what the joint by joint approach is and why it's important for coaches and athletes to understand?
Definitely. So just in the same way, when I first read this concept by Mike Boyle and then expanded on by Greg Cook, pretty famous physical therapist, it just sort of blew my mind. It was like that light bulb went off. And again, talking about, the looking glass of movement, that's basically what this does, is it allows you to sort of understand how the body is ever connected. So basically the joint by joint concept is a very simple way of dividing the body into its different joint complexes and labeling them with certain roles that they have. So if we look at the foot, for example, the foot is a very, I guess you would say mobile structure. Inherently, there's a ton of bones. There's a lot of muscles to it, but the foot requires a ton of stability for proper movement. The foot is basically your base to a house of cards. So if your foot's not stable during movement, if we take the squat, for example, or deadlift, if your foot's not stable and it's rolling around, the rest of your technique will never be as good. So one thing we talk about is with the foot is maintaining a tripod foot. So if you have 3 points of contact, your heel, the base of your first toe, the base of your fifth toe, if those are all in equal contact, like a tripod, you're going to have a stable foot. You'll see an arch for most people develop in the foot. And if you can maintain that, the rest of your body will be able to move well. So we have a stable platform. Now, right on top of that, the joint by joint concept sort of goes through and shows how the body is a bunch of mobile platforms on top of stable platforms. So if you have a mobile foot, you're going to need a stable foot needs a mobile ankle. Now, when people look at the ankle, obviously we think many times that it's too mobile, because when people sprain their ankles, a lot of people contribute it to, too much mobility right there. But what we find is that it's actually more so that we need the mobility going in the forward and backward range. So we call that dorsiflexion. The ability of the knee to go over the toe is called dorsiflexion. And a lot of people have limited ankle mobility. And what happens is that if that ankle is stiff, it's going to have a breakdown elsewhere in the body. So the joint by joint concept allows you to sort of understand the connection. So we have stable foot, mobile ankle. We have stable knee, mobile hip. Now the hip is one that needs both mobility and stability, so it's sort of a two-part joint. We then have a stable core or stable low back lumbar spine. We need a mobile thoracic spine, and it goes all the way up. But if you can understand that each one of these areas basically has a role to play, and inherently each area is prone to certain problems. So take, for example, the core, your lumbar spine. Inherently, we need it to be very stable. We want to have a flat, braced core through any lift or any movement, really. Well, inherently, the lumbar spine is also prone to sloppiness or breakdown. We see a rounding back or an overarched back, and some people, if they have that Instagram model squat, I call it sometimes. So you'll see different joints that will break down in certain ways, and it's affected by other ones. And as a strength and conditioning coach and physical therapist, I think the thing that sort of blew my mind the most is when you see a movement problem, using the joint by joint concept allows you to understand how each part of the body fits in to fixing that movement fault. So for example, if we see the common issue knee cave, if we see those knees wobble around in a squat, whether it's on two legs or one leg, we know by the joint by joint concept that's not just something that's wrong at the knee. If you see knee cave, if you just do a bunch of knee extensions or hamstring curls to strengthen the muscles that surround the knee, you miss the entire picture because the knee is influenced by the mobility and stability of the hip and the mobility of the ankle. So for example, if you have a stiff ankle that cannot go into dorsiflexion, as you squat down, your knee's unable to translate further forward past your toe, your knee will break down its stability because the ankle has been blocked. So if you think about someone driving forward up to a roundabout, if you have a block in your ankle that limits dorsiflexion or limits your ability for your knee to go past your toe any further, it's like you're coming up to that roundabout and you obviously can't go any further, so you have to spin off. You have to go around the roundabout. Well, that's what happens when you have an ankle block. Basically, that knee's going to try to translate forward. It's going to hit that roundabout, and it's going to have to go around in order to translate further forward. So that's why people are able to continue squatting when they have an ankle restriction. In the same way, we talked about the hip is sort of two-part. You need mobility, but you also need stability of the hip. The hip, especially your lateral glute muscles, control the knee. So your lateral glute muscles control for what's going on at the pelvis and where that knee's going. So when someone comes to me with a knee cave, one of the first things we're doing is assessing the strength and the control of their hip muscles. And a lot of the exercises we're going to be performing to be able to correct for this movement fault are going to be lateral hip strength and coordination to be able to get those muscles to kick back on, to turn on at the right time, to correct for the knee instability issue.
I love that. And I hope I'm not putting your words in your mouth. I think I'm accurate about this. You preach to, like, if you're going to correct the squat, then do corrective exercises in the actual squat, right? Rather than, so if we're talking about glute activation, rather than just doing a ton of hip thrust and bridges, you might just do some distractions, when the athlete is actually doing a squat, some knee out drills, stuff like that.
It really depends on what's going on with the athlete, how bad the movement problem is. For example, let's say you have an athlete who has, and I'm talking about this right now on Instagram, is a hip shift problem. Well, their hip shift may be caused by a couple of things. It could be inactive lateral glute muscles. You could have a glute max insufficiency that's for some reason turned off. Maybe it's due to pain. Maybe it's due to the way they've been sitting for a while. It depends on, is the problem something I can correct in the squat, or is it something that I maybe need to take that athlete out if it's so bad and then do corrective exercises? However, even with that athlete, so let's say that person is in real bad shape. They just have no strength or coordination in that glute. So I had to take them out. I had to do bridges. I had to do some hip thrusts. In the end, if I also don't take that athlete back and fix their squat movement,
right,
again, I missed the full picture because I did not retrain the entire movement back to 100%. So that's the thing that we, especially I think in physical therapy with some people that don't understand athletics to the fullest extent, is you may take someone who has some pain or some weakness, and if you only address the strength weakness or the range of motion problem and you get them back to full, but you never retrain the full actual activity that caused them to hurt in the first place, you never fully get that athlete back to 100%.
Right. Can you explain the Gray Cook adage of maintaining the squat but training the deadlift?
Interesting. Gosh, that's a tough one. And I think Gray, from what I have seen on his opinions, loves the deadlift. I think if he were to pick one versus the other, he likes training the deadlift a little bit more than the squat. I think the big thing to understand is both are important. You can't just squat and think that you're hitting the body with all of its requirements in order to keep it healthy and to keep it strong. It's obviously a very different stimulus when you're picking something off the ground versus just hoisting it on your back. So I think probably the big thing he was talking about is maintain the squat as far as your coordination, as far as your bracing ability, the ability to show full functional mobility, but then train the deadlift in that you are then taking that prerequisite ability to move well and then strengthen on top of that.
Right. Do you think there's something underlying that there's some risk associated with heavy squatting on the spine?
I think there's a lot of people that think that. Yeah, I have not ever read anything that can show that the squat, when performed heavy for a long time, can deteriorate the spine. In fact, if you look at a number of research articles, the spine, when performed, and this is, again, it all comes down to, is it performed with good technique? I think there was an article that was performed on a research article, and it was on someone with a world record squat at the time that the article was written, and they did a biopsy or in different pictures of their back. This dude had, I think his squat was well over 1,000 pounds. And I'm not sure if it was raw or equipped or anything like that. But basically, he had the strongest bone mineral density ever recorded.
Wow.
I'm talking, it was, thousands and thousands of pounds more so than the previously thought end range capability of the spine before it would completely collapse and fracture. This dude was completely off the map, and it's because his body has adapted to the stresses imposed on it. So that's the thing, is when you lift heavy for a long time, especially with the spine, you're going to get a ton of compressive and shear forces. So compressive forces, obviously, things compress like two bricks slammed together. Shear forces is the force of two things sort of sliding against each other. Now, when you have a back squat, when you squat down, your back isn't straight up and down. Your back is at an angle, and the barbell's pushing straight down. So there's a little bit of space, especially at your lumbar spine, in the bottom of deep squat between the vertical path of the bar, if you were to draw, look from the side, and where that vertebrae is. So there's a number of different forces that are placed on the spine. Well, if you have, let's say, maybe a little bit of round in your back at the bottom of a squat, what happens is that your body adapts and will actually, the outer part of your disc that separates each different vertebrae will sort of break down a little bit. It's called the annulus, and over time it can break down, and then if with proper loading, it'll actually scar back over. So if you look at a proper training program for anyone in weightlifting or powerlifting, you've got a couple weeks of loading, and then you've got a deload week or a rest week, and then you load. It basically looks like a wave pattern. Well, that's not just performance wise, for your muscles to be able to recover and your central nervous system, but it's also for, the smaller structures of your body, like your spine, to be able to heal and scar down and to create a harder, anatomical surface to be able to handle further loading. If you were to continue loading and squatting heavy every single day, your body's not going to be able to adapt and have that scarring down, and eventually you could reach the point to where you have like a bulging disc or an end plate fracture. Basically, your vertebrae will break down and will fracture because it's unable to adapt to the loading process. So I think long-term wise, I think heavy squatting is something that you should be able to do for the rest of your life.
Right.
I'm going to be squatting heavy until the day I die. That's for sure. But the point is that it's not just heavy squatting in itself. Mm-hmm. That's a problem. It's, that you have to be understanding of. You have to also have a good understanding of proper training periodization in order to keep your body healthy for that long. And I think if you take proper rest weeks and you listen to your body, I don't see why the body would not adapt and continue to progress, its capabilities for the rest of your life.
I love that. In one of your chapters, you talk all about stability, and there are three different types: cognitive, movement, and functional stability. Can you kind of sum these up for us?
Yeah. So, as far as our movement capabilities, there's sort of the mental way that you can stabilize, understanding where your body is in space. We call that proprioception. We find, especially in athletes who are very hypermobile, they have a ton of mobility, that their ability sometimes to understand where their body is in space is lost because you don't necessarily stress what we call these mechanoreceptors, your body's ability to realize where it's at and how much tension's on certain muscles. So stability is just as important as mobility. Now, mobility is obviously sort of a key word that a lot of people have thrown around. Obviously, partially in part due to, Kelly Starrett's amazing work with Mobility WOD, which is so good, but it also, in the same thing, could have gone hand in hand with Stability WOD.
Right.
Just like when we go back to the joint by joint concept, you have mobile platforms and you have stable platforms, and each one of those play off of each other. So you need to be able to have the ability not only to create movement, but to limit movement. So stability and strength are two different things. I think that's a concept that a lot of people don't understand. Strength is your ability to produce force. So if I take a muscle and I push it to its max and try to create as much force as possible, lift a barbell, that's pure strength. Stability is the ability to limit excessive or unwanted movement. Now, if we talk about the core, your core needs to be very stable in that we need to be able to maintain a very neutral or braced, slightly extended spine, depending on what you're doing throughout a barbell lift. Now, yes, you need to have a baseline strength to be able to produce stability. Most people, though, I think most of our athletes are already very strong. They just don't understand how to take that strength and stabilize something. And that's going to come out in the way that we train. So if you think about core stability exercises, too often I see athletes doing like glute ham raises or reverse hypers, or even worse, crunches, thinking that they're producing the added quality of stability to their body, and they're not at all. You're only producing strength, whether it's in your erectors, whether it's in your abs. Planks are going to be a much better way. And then on top of that, you can go into many different types of movements like the bird dog and whatnot. But basically, our goal in training is to understand that we need to be able to brace and to limit excessive movement at the spine and then produce movement elsewhere. Mm-hmm. That's correct, stability training. And that's going to echo in your ability to control a deadlift, control a squat, throw a baseball, jump over a hurdle, all those different things. Is you need to be able to have that stability, because when you have improved stability at a joint or joint complex that's closer to the middle of your body, we call it like a proximal joint, it actually improves your ability to produce strength, power, and have mobility elsewhere in your body. Mm-hmm. So if you have improved core stability, you will inherently give your body the potential to produce more power, strength, motor control elsewhere in your body, like your legs during a squat, during a throw, or something like that. So that's why it's so important to have, core stability training in every athlete's movement.
Yeah, I couldn't agree more. I love this concept of anti-core training, especially, right? Where we're resisting different forces, anti-extension, anti-rotation, where instead of, crunching and moving the spine in different directions, we're moving other body parts while keeping the spine stable. So if you look at a football player, a linebacker hits a lineman, they don't want their shoulders to be thrown back, right? They want to maintain the same trunk position, so maintain the same spine position, and that can be trained through exercises where other body parts are moving, the spine is staying the same. But a lot of people, it's just sexy to see the abs like moving all around, and you know what I mean?
Exactly. Yeah. You'll sell a lot of products that way on infomercials, and you may get a bunch of clicks on Instagram. But in the end, you're not treating your body in the way that it needs to be in order to perform well and perform for longevity wise if you're not training for true core stability, which is, again, limiting excessive motion. So, just a simple thing you can do. You can attach a light band to any rig, down at your feet, and then grab it high. Brace your core like someone's about to punch you right in the gut, and then move your arm or, forward to the angle, move it in at a diagonal. All those different forces are going to try to move your spine, whether it's trying to rotate it, whether it's trying to extend it, to overarch it, whether it's trying to flex it and have it bend. And your goal during all those things are to limit that excessive motion, to maintain that brace, maintain that neutral spine position. So really, core stability exercises, there's not a limitation on how many you can do or different types. Anything can be a core stability training exercise with the right emphasis. So, even your barbell deadlift, your barbell squat, that is a core stability exercise with the right emphasis of approaching the barbell, thinking you're getting under the bar, bracing your core like you're about to get punched in the gut, and then maintaining that core in spinal position throughout the entire movement.
So transitioning into mobility a little bit, what's the latest and greatest in the mobility world? What's the absolute fastest way to increase your mobility? And keeping in mind everything that we've been talking about in terms of the joint by joint approach.
Definitely. I think you need to look at each athlete individually to understand what their body needs to improve mobility. So, for example, I think the ankle is obviously one of the most limiting factors in most people's movement. And in doing so, if you have stiff ankles, you're going to have foot collapse, you're going to have knee collapse or knee cave in during movements like the squat or your clean or snatch. So understanding the ankle, I think, is a huge thing. Now, when we look at the ankle, there can be a number of things that are blocking it. You could have soft tissue restrictions. That's going to be your muscles, your fascia, which is basically like a spider web of connective tissue that sort of runs around and envelops muscles. You could have a restriction in those that limits your ability to go forward. You could also have, a joint restriction. Now, this could be just joints not wanting to move very well. They haven't been used in a long time. You could have, different bony buildups. You could have scar tissue. For example, I have a lot of athletes that come after a sprained ankle and they develop a little bit of scarring down around that joint and they have that bony block. So, the way that you address that mobility restriction is going to differ from person to person. So understanding what your body needs is the fastest way to get that mobility improvement. That's the one thing that I really try to preach with all the different things that I share on social media is the exercises that you show and the things that you see on other sites other than mine, because there's a lot of other physical therapists or strength and conditioning movement people out there that are showing different corrective exercises. Not everything that you see is something that your body needs. Mm-hmm. You need to understand and sort of put together a recipe for what your body needs and what your body needs at this time. Because while right now your body may need some banded joint mobilizations to take away a joint impingement, you may not need that in 2 months. You may just need maybe a little bit of foam rolling and some stretching before your workout, and you're good to go. So showing people ways that they can sort of self-screen their body to understand what their body needs leads to empowerment, leads to an understanding of themselves taking control of what they need to do to be able to get better. Because that's the worst thing. The one thing I don't want to do is ever walk into a gym, whether it's a CrossFit gym, a weightlifting gym, a powerlifting gym, and see like 20 people lined up all doing banded joint mobilizations for their hip, mm-hmm. which I have seen before. The amount of people that actually need that, it may have been 2 out of that 20. Corrective exercises need to be individualized to the person. So as a strength and conditioning coach, as a physical therapist, you need to be able to understand how to give out different exercises so it fits each athlete where they're at the time, and then how to modify them once they're out of that. Mm-hmm. So basically to answer the question, the quickest way to, improve mobility is to find out what your body needs specifically and then work on that. So if we talk about the ankle, there's a very simple stretch or test called the 5-inch wall test. You basically kneel down to a wall. You put your foot 5 inches from that wall. If you don't have a ruler, your thumb plus fist plus an extended thumb is around 5 inches for most people. You drive your knee towards that wall and you see what happens. Can you touch your knee to the wall at around 5 inches? If not, why? Do you have a pinch sensation in the front of your ankle that's limiting that? Do you have stiffness in the back of your ankle maybe that's limiting? Or do you have both? Something like that. That's a way that you can test yourself every single day you go to the gym. Am I good? Do I have something I need to work on before I start loading up the bar? Because if not, then you're going to be loading a body that's unable to move fully to its greatest capability, and you're going to be loading forces eventually with broken down technique that, again, is going to lead to eventual injury.
Keep going.
So, I mean, another thing too, we talk about mobility improvements. A lot of times we think stretching. When you think about stretching, again, you can't make very blanketed recommendations. Stretch for 10 seconds for everyone. Not everyone needs 10 seconds. If we're talking about ankle mobility restrictions, some people need longer duration stretches in order to see greater improvement in their range of motion capabilities. There's some articles out there that have shown that longer duration stretches, so stretches held anywhere from 45 seconds to a minute, will naturally decrease that muscle that you're stretching, that capability to produce strength, power, and force. So if you take an athlete and you're stretching the crap out of their ankles for really, really long duration stretches, let's say you do like 5 stretches for a minute prior to doing some training, whether it's jumping, squatting, anything like that, naturally you're going to have less power capabilities out of those muscles directly after. Mm-hmm. So a lot of people will take that and they'll go, all right, well, every single person, you need to stretch 10 to 30 seconds or something like that. Do short duration stretches. Well, it's a very good general recommendation. But again, as a strength coach, as a physical therapist, maybe as an athlete looking for ways to improve their own body, you need to take into account where you are at individually. If, for example, you did that 5-inch wall test and you're not even close, you've got like 5 inches, basically, your knee didn't even move anywhere, you've got what would I consider a very, considerable range of motion restriction. Your body maybe at that time would better perform with longer duration stretches, because in doing so, you're going to improve your range of motion more so than doing like 5-10 second stretches, which is going to give your body the capability to get into better technical positions during your training, which again, all leads back to the concept of movement before production. And if you're getting into better technical positions during that training, while maybe those muscles that you stretched are not performing force-wise, power capability-wise to its greatest capability, if you were to do shorter duration stretches, you are now moving better. And in doing so, you are setting your body up in the end to have a greater longevity with less risk for injury, and giving yourself the potential maybe a year down the road, 2 years down the road, if you continue down that path of improving your ankle mobility, to get into even more performance than you're capable of right now. So again, back to the patience talk is, these things that we're talking about, while you may not have the technique to do it now, have patience, work on your mobility, and know that your end goal is not next week or next month, but 2, 5, 10 years down the road.
I think this is the perfect segue. So obviously we want people to, and what you're really making a stand for with all of your work is that people become the CEO of their own movement, right? Like 100%. They own their own movement. Now, yes, there are going to be a lot of people, and I'm sure you come into contact with so many of them, that they feel overwhelmed by the amount of shit that's going on, the amount of things that they have to learn about to really understand it and make the appropriate corrections for them, right? They just feel just plain out overwhelmed. So they want to find an expert in their area that can really kind of walk them through. And there are physical therapists and chiropractors and doctors out there that they're just in the business of treating pain, right? They just treat that one site where the pain is, and when the pain is gone, they think their work is done. And what you're talking about, your book, it's about finding out what the root cause is. And I look at it like a drug addict. You can take away the drugs and the alcohol, but if you don't address the underlying issues, whether it be trauma or whether it be just they don't know how to cope with emotions, then they're almost always going to relapse. And if you don't treat the underlying issues in poor movement, that led to an injury, then you're almost always going to get re-injured. it's hard to find people that think that way, right? So
Mm-hmm.
how can people go about finding someone in their area that speaks your lingo, that looks at the body as a whole rather than, you know, just like by one body part? Like what might that person say, and what are maybe some questions that people can ask these experts to see if they're the right fit?
Definitely. And I know this is something that I hear on a daily basis from different patients. I see athletes of all backgrounds that have had very poor experiences with whether it be physical therapy, whether it be chiropractic care, where they have gone to someone and they have expressed their pains and what's going on, or any type of medical professional, and they say, well, just quit doing that. Your knee hurts. Well, just quit squatting and take this drug, and a couple weeks off and you'll be good. Or well, let's rehab and we'll do these things, and as soon as their knee feels good, they're like, well, I want to go back to doing squats and CrossFit, and they're like, I wouldn't, because that's going to lead you back here again. So there's a lot of people who have no understanding of how the body should perform as far as being a strength athlete. So I mean, the first thing you can do, no matter where you're at, is just simple Google search on the internet, is trying to find a sports physical therapist or a sports chiropractic care, and call up that clinic and ask to talk to someone and ask them what their background is. Have they themselves ever competed or have a background in strength and conditioning, weightlifting, CrossFit, and powerlifting? Now, there's not a lot out there right now, but I do see that this is a very growing field. I mean, I see people all the time that are putting out stuff on Instagram or any other social media platform. I'll just click around just to see, and it's like, so-and-so, raw power lifter, physical therapist. And I'm like, oh, that's pretty cool. You're seeing the emergence of a lot of people who are strength athletes that are starting to become practitioners medically wise, that are putting out a lot of amazing stuff. And I think those are going to be your first bet for someone who has a difficult situation where you've been dealing with aches and pains for a while. That something isn't right in your body. The first person you should go see is a trained medical practitioner, like a physical therapist, who understands the body way more in depth and can help you sort of along your way, because they're going to be able to understand how it's not just maybe your knee, maybe it's the hip that's causing the knee pain, but they're also going to understand your desires and aspirations to be an athlete, in that they're going to get you back to what you want to do, because they understand themselves what you put yourself through to get there, and the desire to want to perform. Oh, yeah.
Keep going, man. You're like foaming out the mouth. I love it.
Yeah. And this is something that just personally, if anyone has recently watched, I put a trailer out for my first documentary that's going to come out at the end of this month in January, called Josiah's Story. It's about a power lifter who basically sustained one of the worst injuries ever caught on tape. He was squatting 655 pounds and basically had an incident where everything just sort of snapped in both of his knees. He ended up tearing almost every supporting ligament and tendon in both knees: ACL, MCL, PCL, quad tendon, patellar tendon, everything snapped. Oh. And the weight fell on him, basically. And he had, rushed emergency surgery. He basically, because the muscle damage was so bad afterwards, he developed rhabdomyolysis, which, if everyone knows about that, man. So his kidneys were shutting down due to the problem with the muscle damage. And then he was put into leg braces, and because the damage was so severe and the tendons were so degraded at this point, he wasn't able to bend his knees for 12 weeks. So he's walking around in straight leg braces for 12 weeks. And then he started shopping around for physical therapists once his surgeon was like, all right, it's time to start the journey. And I got a call from him, I remember vividly, and it was in January of last year. And he was basically like, hey, man, here's what happened to me. I've been sort of talking around. I think he got my name from Dr. Brian Mann, who he's been in the powerlifting community for a long time. He works at the University of Missouri. I think he sort of gave my information and made some connections and called me up, and he just, wanted to understand, what could I do for him? And the first thing I said to him was I can definitely help you no matter where you're at. I understand, the demands of what you go through as a power lifter every single day. I understand the mindset of being a strength athlete. I understand where you're at right now, unable to even walk. And this is something wholeheartedly I wanted to jump into and take him on that journey. So our documentary sort of documents that entire journey up into his point of being able to return to the platform. But basically showing that, there's going to be situations where athletes are going to get into where they're not going to know who to trust. Who do they talk to? Because is the physical therapist that they're calling up or the chiropractor that they're going to call up, does that person know what they're doing? Does that person know that that they want to get back to squatting, to deadlifting, to doing Fran, to doing all those different things? And are they going to be able to help them get back there? Are they just going to say as soon as they're back to being pain free, all right, you're good, just try to go back to doing what you're doing? At my clinic at Boost Physical Therapy, I've got an Olympic weightlifting set over in the corner with my own platform, because if I've got an Olympic weightlifting athlete or a CrossFitter, I'm going to be doing lifts with them in physical therapy before they go back. Because if I just got them to where their elbow or their knee wasn't hurting anymore, and maybe they're doing body weight squats or light kettlebell squats like some physical therapists do, and they're pain free, if I was just like, all right, go back to trying snatches and clean and jerks, without ever watching them do that, I'm doing a disservice to them, because I'm not fully getting them back to the sport that they want to do and meeting the demands of that sport, coming from, a biomechanical standpoint, an injury standpoint, rehabilitative standpoint. So I know it's a lot right there. Basically, the big thing is I would Google. Here's some practical advice. I would Google sports physical therapy. I would then take what you find. I would then call up each one of those offices. I would ask them, do you have any practitioners, any physical therapists who have a background in strength sports? Are they CrossFit athletes? Are they, strength and conditioning minded? If you look at an athlete's list of credentials, physical therapists now are PT, DPT. That means that they're a physical therapist with a credential of a doctorate in physical therapy. So they went to school for a long time, probably got a crazy amount of student loans like I do. After that, you may see some other credentials, different things that will tell you if that physical therapist understands strength and conditioning sports. They may have CSCS. That stands for Certified Strength and Conditioning Specialist. That's basically the gold standard in strength and conditioning certifications for anyone that wants to be a strength and conditioning coach. That's from the NSCA, or National Strength and Conditioning Association. You may see other things like USAW. They're a USA weightlifting certified coach. They may be a CrossFit level 1 certified coach. They may have FMS. Basically they have the FMS certification, or SFMA, which is sort of the next step above, which is even better, which means that they've gone through the certification process that Gray Cook and his entire movement systems company has put together, basically train people how to break down the body and understand the joint by joint concept on an even crazier level than what I go through in the book. So there's a couple practical things that you can look for to see, does a physical therapist have credentials that gives them the understanding of what you are dealing with as a physical therapist, or as an injured athlete.
I have this theory. Let me know if you agree with it or disagree. But I feel like if you go to a physical therapist or chiropractor and they only do like pain relieving techniques like cupping or Graston or scraping, and they don't give you corrective exercises, you're probably just burning a hole in your wallet.
100% agree. And that's one of my biggest pet peeves is I've seen people on social media that put out a post of them getting Graston or dry needled or cupped. And they're like, oh my gosh, my physical therapist did it, or chiropractor did a great job on me today. I will use some of those techniques, but way longer in their training session. That's not even close to one of the first things that I'm doing on someone. And in doing so, I tell them that this is a partial remedy for what we're going. This is an adjunct. This is something that I'm trying to do in conjunction with everything else. This is not even close to the main treatment. It's something I see in a lot of people, especially Graston technique. And here's the thing with that is you're spending thousands of dollars on a certification to be able to use a couple of extremely expensive tools. I can pick up a $75 piece of, exactly. I can do the exact same thing to you. And I guarantee no person that is Graston certified will tell you that you can't, because you definitely can do the exact same thing without a thousands of dollars in tools. And that, it goes to every single type of modality that different people will use. You will see people that will, and probably because they're getting paid for it, will have different Instagram posts or social media posts where they're using different devices. I don't care if it's cryotherapy or electrical stimulation or this or that, any type of therapeutic device. And they'll say that this is what's being the end all be all and helping me recover. No, it's not. It is, if anything, a small adjunct to what you should be doing overall. And if you're not doing everything else correctly, if you're not moving well, if you're not doing your corrective exercises, if you are not sleeping well, if you're not eating well, if you're not managing your stress well, all of those things make up probably 99% of how your body is performing and recovering. And this may do 1%. It's sort of the person that picks up a bottle of creatine and thinks it's going to automatically give them new PRs. You're not going to see that much if you're just adding, a little bit of a small supplement on top of, all this else that's dysfunctional. You haven't addressed your eating, your sleeping, your drinking habits, all that up to it. All those different things. It's a supplement. It's not the end all be all. But too many people today want to make a buck off something and are willing to sell people this facade that something that they can buy or something that they can, pay a lot of money for is the end all be all in helping them recover or hit their next, personal goal.
And unfortunately, I think it's the experts themselves that just don't have the knowledge. They just don't even know how to view the body as a whole. That, the pain goes away for a day and that's just all they know how to do. A lot of them. Right. And I think those people that are posting this shit on social media and telling their friends about it, they do it immediately after they meet with a physical therapist or chiropractor and they're feeling good for like 24 hours. And then it just goes back to how it was. I've never heard of someone or experienced myself someone saying, I got some cupping and it went away forever, or I got dry needling and it just went away forever.
Yeah. Well, and that's the thing too, is just because there's an absence of pain does not mean that there's an absence of dysfunction in your body that will continue a pain cycle. For example, in a recent blog article, I talked about quad and patellar tendinopathy. Okay. So tendinitis, pain for basically most people. That's how everyone calls it. If you do an isometric contraction, so let's say you do a wall sit, very simple exercise, usually pretty easy. Research has shown that you can do 5 sets of 45 seconds on a wall sit. And what that's going to do is decrease your pain. It may even completely take away your quad or patellar tendon pain for upwards of 45 minutes afterwards. Does that mean that I fixed your injury because I had you do some wall sits? Not at all. In the same way, just because I can do some scraping technique or because I can put some electrical stimulation on your body and decrease pain for a little bit, that doesn't mean at all that I fixed why the problem is there. And that's the big thing is, again, this all circles back to the same thing of our society. We're looking for so much of that quick fix, the next PR, production, and you don't address why the problem's starting. You don't have patience in addressing movement problems or why that pain is there. And it's short-sighted and going to give you short-sighted and short-term results. It's not going to give you long-term, changes in your body and take away pain and improve your control and fix your technique.
I've got 2 rapid fire questions. I want quick answers and then let's get out of here. I've already kept you over how long I promised you. What book have you given most often as a gift, or would you give or most recommend to people?
Ooh. Okay. So here's a gift, and this is not even physical therapy related. This is a book that is basically the entrepreneur's journey into understanding his life, finding out how to live his life and to understand what's capable if you work hard. And it's called The Icon Effect. That is a book that I've gifted to a lot of people. And it's a quick read. You could probably read through it within a couple days, but it's worth it. It's called The Icon Effect.
Hell yeah. What is one action that you'd recommend people take immediately that will have a significant effect on their life, their performance, or anything?
Listen to your body and don't ignore pain. 100%. Listen to your body. So many strength athletes come to me down the road when they have a significant injury and they go, well, I was dealing with this hip issue. It's just, it was a little painful, but I just thought I'd just keep on lifting with it. There is a difference. Self-actualization. Take some time and listen to your body. There's a difference between pain and muscular soreness. As a strength athlete, you are going to be sore. You are going to have aches and sorenesses all the time because you're putting your body through hell every time you're training hard. But that is not the same thing as pain. Pain is sharp. Pain does not go away when you warm up. Pain lingers. Pain does not, from day to day, it makes you feel like you're changing. You can't sleep well. That is pain. You need to listen to your body. You need to go seek help or look for help yourself as to how to fix that, because pain, just like the warning light in your car, if you're driving your car and your warning light pops on and you go, screw it, it'll be fine, and you just keep on driving your car, right, something's going to happen. There's a reason that light's on. And eventually your car's going to break down. The exact same thing is going to happen to your body if you continue to push through pain.
Bro, this was phenomenal. You dropped some very, very valuable information on this show. We threw some stones. I'm not ashamed of it. We threw some stones, but I think this is some very valuable information for coaches and athletes. Where can people keep up with you personally, and what do you want them to know about your business?
Man, my biggest thing that I want people to understand is that at Squat University, I'm giving away my best information 100% for free, because my goal is to give you empowerment to understand your body, to fix your problems, and to find how truly capable, strong your body can come. I don't care if anyone ever buys another copy of my book. I want you to be able to find out how strong you can become and decrease your pain. You can find all my information, Instagram, Twitter, Facebook, my blog website, squatuniversity.com. Click on the blog article technique or the blog article thing at the top. There's a ton of information on there. You can reach out to me. It's tough to get through DMs nowadays on Instagram because it's crazy right now, but Email me at squatuniversity@gmail.com. If you have a question, I promise you I will get to it someday. It is pretty crazy to get back to people, but one thing I used to do is I would sit on Thursdays and I would just DM people and email people back for like 4 hours at a time, because I wanted to try to help as many people as possible. And it's obviously a little bit harder nowadays to be able to get to as many people because I've got so many coming in. But if you can email me right now, that's probably the least busy platform to get back to people, and I will try to answer your question and help you out. The biggest thing I would take away from listening to this is if you can listen to your body and perform, good quality technique, and take technique and put it on a higher platform than your performance, good things will eventually happen.
I love that. One last personal question. With the volume of direct messages you get, are you getting dick pics? Are people sending you dick pics?
I have actually not had one at all.
Nice.
I'm pretty surprised. I don't know if it's maybe the type of information I put out. I don't have any dudes without shirts on any of my Instagram posts.
With the amount of value you are giving away, you'd get at least one dick pic. I'm not inviting anyone to send him dick pics.
Yeah, please don't. Anyone listening to this, please don't do that. I have not had one yet. So.
All right, brother. This has been great. Thank you so much for your time, and we will talk soon.
It was an honor to be on the show. Thank you so much.
All right, man.